So right now,
Okay.
I'm a pain nurse practitioner. As a band 7, I could become a clinical nurse specialist.
Hello, beautiful people. It's your girl Ada. Thank you for joining us. And today I have come with something very, very important and interesting, which I'm sure you want to know. I've got somebody here sharing the screen with me today. I'm sure you're wondering who it is. So I'm just going to let her introduce herself and then I'll tell you all about what we have today. So, welcome to our channel today, beautiful lady. Do you want to tell us a little bit about yourself?
Okay. Hi, everyone. My name is Mercy. I'm a nurse. I am currently practicing in the UK,
Mhm.
and I've been in the UK for almost 3 years now. Yes, and I'm
Okay.
also a YouTuber.
We're just gonna go straight into today's video. So guys, today, just like the topic says, we're talking about one of the best nursing specialties you can think of joining. So let's say you're a nurse in the UK, you've been in the ward in the NHS trust for a couple of years, and you're wondering like, I need to leave the ward. I want to go into a specialty and I just don't know how to go about it. So today I've brought you somebody who has been able to pick a specialty, and like one of the best specialties, I'll tell you. Like I see these girls in the hospital when they come in, I really do admire them. Oh, I love this specialty, but I just didn't know so much about them. So I was so glad when I came in contact with this lady. So today is not just for you, the viewers, it's also for me learning. Just maybe I might consider a pain specialty as well. So I'll let her tell us about her specialty and how she decided to choose this specialty and stuff like that. All right, Messi?
So, my name is Mercy. Like I had introduced myself, I am currently practicing as a pain nurse practitioner. I moved to the UK in November 2020 and I was working on the surgical floor. I was looking after patients who had surgical cases, so pre op, post op, and they were transferred back to the ward from the theatre. So, because I was working on the ward then, I had experiences with the use of devices that people use in pain management. So PCAs like patient controlled analgesias, epidurals, and things like that. What made me go into pain management was because of a patient I had who was in so much pain. Like coming from Nigeria, I didn't even know there was a specialty called pain.
For pain. No, I had no idea as
I
well. Like
had absolutely no idea. But then I came into the UK. I had this patient who was really, really in pain, and I went to speak to my line manager as at then, and she said, make a referral to the pain nurse. And I'm like,
and you're like, who is the pain nurse?
yeah. I said, oh, okay. Anyways, I was able to get in contact with the pain nurse. She came to review the patient, did some prescriptions, and the patient's pain was controlled. I was like, amazing. So I went back, I did the research on my own, saw that, okay, this specialty is something I would want to go into. Plus the fact that I was working on bedside then and I didn't want to remain as a bedside nurse, and this is not bedside. So I decided to,
Switch a pot.
that's the word. I started supporting pain nursing, and that's what I'm doing right now.
Okay, so do you want to just like quickly tell us some of the roles of a pain nurse? Because I'm sure for some persons this might just be the first time they're actually hearing that there's something called like a pain specialty. Do you want to tell us some of the roles of a pain nurse in the trust or in the hospital or in the ward?
Okay, so basically, people who are in pain, they get to see a pain team, so a pain management team, and
Okay.
it could be people who are in the hospital, people with acute pain, people who have
Okay.
just had a procedure and they are in pain, like pain that has just lasted for like 0 to 3 months, or people who have had pain for a very long time. So we call that chronic pain. So people who have been having pain for a long time, they get to see the pain team as well, and their pain is being managed. So if you are looking to putting into pain management, these are some of the things the pain management team does, is to take care of people who are in pain. I'm working in the hospital, and some of the things I do is to go see a patient who has been referred to us. So if this patient has just come back from the theater with a device that the staff on the ward do not know how to use, they refer them to us. We go to review the patient, see the kind of device and educate the staff on how to use it basically, and then also manage the pain of this patient. So I look at referrals from the ward because that's part of acute pain management, and for chronic pain management to do some clinics as well. So people who are being referred by their GPs or referred by other people in the hospital to see the pain team, they come to the clinic to see us in the clinic, and we review them and see how we can help manage their pain. So there is pain management devices where we do trainings on those devices so that the staff who work on surgical floors can be informed
Yeah.
and be able to use
And
those.
use, yeah. I find that very interesting, like, because because of where I work, as I told you, I've attended like pain day. We usually have like a pain study day. Like we'll have that like every 3 months because we deal with pain a lot, because that's basically what my unit is all about. So whenever I attended one of the pain study days, I was speaking with one of the nurses. I'm like, oh, this specialty is something I would actually love to get involved. I never actually went through with it eventually. So I wanted to ask, is there like a special training you would need to do before you can apply to be like a pain study or like a pain?
Well, to be honest, there is no special training per se. Wherever you are working as an individual, if you are intending to go into this specialty, there are skills that are transferable. So depending on wherever you are coming from, you can transfer some of these skills as a bedside nurse into pain management. Okay. What I did that gave me an edge when I was applying for jobs is to go online and do like some trainings, some online courses, just to expose me more to pain nursing, basically, because I absolutely had no idea what pain nursing was all about. Irrespective of the fact that I have been a nurse, I didn't know there was a specialty like pain.
Called the pain, yeah.
Exactly. So I did some online courses and it exposed me to that a little bit. Plus the fact that I was already working on the surgical floor.
Surgical floor, yeah.
So I had exposure to PCAs, epidurals, and things like that. And other than that, I didn't do anything extra.
No special training.
I went on to start applying for jobs.
So
so
a pain nurse is what? Is a band 5 or a band 6?
I am a band 6.
Okay.
But there are some hospitals that employ as band 5.
As band 5, okay.
Yes, so you could be a pain nurse and you could be a band 5.
Band 5, okay. Or you could be a band 6. So what it just means is that so far you're a nurse, you're eligible to apply.
Yes.
Just based on your prior knowledge and if you can, of course, ace the interview. Okay, so I know a lot of persons are wondering, like, now we've heard about this specialty, we want to get into it, but you know the important question, what is the pay like? What is the pay? Is there like a special enhancement? Is it just the normal pay? And what is the hours also like? Because I know, of course, the pay is highly influenced by the hours. What's your rota like? How is the shift run? And things like that. Do you want to just share?
So I do office hours.
9 to 5.
Yes, but I do 8 to 6. Now, my contract is 37.5 hours a week.
Okay.
Yes, and because of that, it's supposed to be 8 to 4, Monday through to Friday.
Yeah.
Yes, but my hospital do something called flexible working, where I do 8 to 6, but then work 4 days instead of 5.
Okay.
Yes, and because of how much we are in my team, the service is 7 days a week. But during the weekends, we do not have everybody coming into work. We just have one person covering the service.
Being on call.
Yes.
Yeah, and so that's how we'll do here.
Exactly. And so we share it amongst ourselves. So I barely do weekends. I don't do nights. I would sometimes say I don't do weekends. I do weekends like one in 6 weeks, which I prefer. Yes.
That's nice. So you You have all your weekends, you have all your bank holidays, you have all that is lovely, guys. I'm sure a lot of persons really love to hear that,
Yeah.
you're free, you can do whatever you like on those days. But what's the pay?
So
Okay.
it's a band six role, and the band six role for the NHS starts from 35,000 with the increase now. So it's a range of 35,000 to, I think, somewhere around 40 something. I'm thinking so. So it's a range depending on your experience and or the number of years that you spend. You grow up on the ladder. So it starts from 35,000 for a band six, or from band five, it's the normal usual NHS pay.
Yeah, well, that's not too bad anyway, considering the fact that you don't do nights and you don't do weekends. So you can actually do, like, some other side hustles on the side, like if you want to. If not, it sounds quite amazing, it sounds amazing and it's lovely. I know a lot of persons who want to delve into this specialty. I, for one, I love the painting. I admire them a lot. Whenever I see them, I admire them a lot. But yeah, I do love the paint specialty. So something else I'm gonna ask now, it's what's like the career progression? Now you're band six in the paint team. What else? Like what's the future looking like? Where can you go from here?
With the career progression, you can become a band seven, a band eight. You can grow up the ladder. So right now, I'm a pain nurse practitioner. As a band seven, I could become a clinical nurse specialist.
Okay.
And then
it's a different name.
Yes, a different name, but different and then different band.
Okay.
Yeah, so like my line manager now, she's a clinical nurse specialist in the role, and you could decide to say, okay, you want to become a trainee nurse practitioner, where you apply to your trust as a trainee, and then they train you, you become an advanced nurse practitioner. And you progress to a band 8.
Okay, that sounds like it's got like loads and loads of career progression. Like,
yes,
you can just keep going.
Yes, depending on what it is you want as an individual, you can decide to say, okay, you want to progress into more of the managerial aspect and just keep growing and growing like that. So there is a lot of career progression in the job.
Oh, that's beautiful. Now, as a pain nurse, you go into different wards. So you meet different people, you're meeting different staff, you're meeting people with different personality, and of course, you're African. And at times, what kind of reactions do you get from people when you walk up to them? You're like, "Can I see the catheter? Can I review this patient?" and stuff like. What kind of reaction do you sort of get from the patients and from the staff in the unit? Like, you know what I mean?
Okay, so to be honest, it's been good so far. It's not been terrible, actually. It's been good. And for the fact that part of my team, I'm like the only Nigerian or the only African in my team, and every other person is not from where I am. So going to review patients on the ward is like, oh, how did she become a pain nurse?
Yeah, that's why I'm asking. A lot of persons who want to know, like,
yes. But when I started doing the job and I started showing the fact that I am informed and I'm knowledgeable of the stuff I'm bringing to the table, and I know what it is I'm talking about, these guys were like, oh, this person knows what she's doing.
Okay.
And then every time I go on the ward round with the pain consultant and everything, they do proper introduction, which is something I am grateful for. It's not like they threw me to the curbs or like just say, just go and do this thing by yourself. But there is proper introduction. So they go and we go to review a patient, and on the ward, they're like, hi, this is Mercy. She's one of the new members of the team, and something, just like that. Just introduce me properly.
So you do get adequate support from the team, that has helped you a lot.
Yes.
In addition to the fact that you also have to be very competent in what you're doing.
Yes.
Okay.
Yeah, so I had to try and just introduce myself more to members of the staff.
That's very beautiful, Macy. I'm so happy to have you here. I'm sure you've actually changed the orientation of the thinking of a lot of African nurses. African nurses here in the UK, I know us, like we are go-getters. We
Yes.
always want to get up the ladder. And a lot of persons at times, they want to do these things. They just need the direction. They just want to know. Like, so guys, Macy is also a YouTuber, and I'll be leaving her link down here. So if you do have any questions as regards this pain specialty, or maybe you want to ask her any other questions as regards interview process and how she was able to ace her interview and get into the band 6 role, I'll be leaving her YouTube link. You can go there, chat out, send her a message on YouTube or even on her Instagram, and I'm sure she's happy enough to answer you. So today, this will be the end of our video today, and thank you so much for watching. I do hope you have subscribed and you've liked, and of course you share this content. I do hope you find my content nice enough to want to continue with me on this channel. Thank you very much, and until next time, bye.